I'll say this is a first for a talk. I'm really pleased to be here today. So I'm going to be a little bit different here. So I'm a physicist engineer. So we're coming at this from a little bit of a device development perspective. So when you heard bubbles, you may have thought of that. This is a scene of my son playing with a couple of his chums. For those of you who went to the bar earlier and got a tasty brewski, you might have been thinking about the carbonation in your drink. And so bubbles maybe have this connotation of, lightheartedness, whimsy. But under the right circumstances, they can really strongly interact with their surroundings. So this is a bubble it's a couple hundredths of an inch in size. It's right along a stainless steel plate. And so what you can see is that this bubble is undergoing very large distortions. It's really slamming down on this plate. And this has been a known issue for about 100 years. So ship propeller design, about 100 years ago, they found that if it was improperly designed, you could have these bubbles that form. They cause damage to the propeller. So this is a propeller famously in Pike Plate Market in Seattle. So bubbles, whimsical, but can also damage steel. When I was in graduate school, I was working on a project trying to use bubbles to generate a fusion reaction. Think of the Oppenheimer movie from a couple years ago, but actually about 1,000 times more violent. So those sort of intermittent flashes of light, those sounds that you were hearing, those bubbles were collapsing so violently, they're generating the light. Those sounds you were hearing, those are shock waves. So nature takes inspiration from this. Also, so the mantis shrimp, very interesting animal, all number of sort of very interesting features, including of which its claw collapses so violently it generates a bubble, and it uses that to stun its prey. So can we use this, can we sort of harness this ability of bubbles to damage things, to kill unwanted tissues in our body, unwanted cells? And so this is an example, this is a suspension of cancer cells. So you can see these bubbles are sort of just, they're expanding, they're punching the cells, they're dragging them back. What they're doing here is that they're just breaking down the cells. You can think of this a bit like the action of mortar and pestle. So these bubbles are sort of grinding down to damage cells. Now, how do we do this for medical applications? We apply ultrasound. So not the type of sort of medical ultrasound imaging you might be familiar with for looking at fetuses in the womb. This is a picture of my daughter just about 2 years ago now. These systems don't have sufficient power to generate bubbles. So we design these specialized devices that have the oomph needed to generate bubbles. You can think of these two systems as our imaging systems are like water pistols, and then our systems are more like bazookas. So I don't want anybody coming out of here saying like, oh, I'm going to go have an ultrasound and might get damaged. No, that's not going to happen. But our systems are still ultrasound, and so we can apply them across the body to target what we want to target without having to cut open a patient. And at the end of the day, what we're doing here is sort of killing cells. And a doctor will tell you this is basically the equivalent of a surgical procedure. So it's like we're performing surgery, but not doing surgery. We don't have to cut the patient open. And so the question is, where can we apply this? As I said, physicist, engineer, I've got a screwdriver, what are my screws? And so one example might be clots. How many people here have known somebody who's had a stroke or a heart attack or a clot in the leg? For a variety of different reasons, the blood within a vessel will form a sort of jello-like substance. And so that stops blood flow from downstream. And so the issue is that those tissues downstream then start to die. So if this happens in the brain, it's a stroke. A heart attack, if it happens to the heart, it's a heart attack. And then if it happens in the leg, it's a venous clot. And even those venous clots, even though they're not as severe, have severe symptoms. You heard that patient in the video earlier, significant lifestyle changes. This can also be quite lethal. So the worst potential outcome for these clots in the leg is they'll break free and they'll obstruct blood flow in the lungs. This is called a pulmonary embolism. And this is a really significant condition. About 25% of patients that have pulmonary embolisms end up dying. And so it accounts for about 100,000 deaths each year. And so for those patients that have clots that are likely to break free, doctors will sort of snake an instrument through your vessels and then administer a medication directly within the clot. So you can sort of think of these clots as like bags of red blood cells held together by a mesh netting. This medication acts to sort of break down the mesh netting and dissolve the clot over time. there's a lot of issues with this treatment. So it doesn't work in about half of patients, and that's because about half of patients have older clots. That mesh netting I talked about earlier changes over time and no longer responds to the medication. So even if your clot does respond, there's a lot of sort of issues with it. It's a very lengthy procedure. So the medication is administered for about 2 days. This leads to high healthcare costs, so it's about $22,000 per patient, or about $10 billion nationwide. And then there's the potential for bleeding complications, as was discussed earlier. And so this is an issue because even in cases for clots that are not likely to break free, we know that there are better outcomes for patients if we can treat them. And so at this point, doctors are really only administering this when they absolutely need to. So that's where we say, like, okay, can we use something else to have a more effective, less costly, safer treatment? And so that's where we come back to our bubbles. So we talked about earlier, these bubbles can be used to sort of macerate tissue. Can we use that to break down the clot? The other thing that's interesting about these bubbles is they do a really good job of stirring up the fluid around them. You can see all these sort of little particulates being drawn into this cloud of bubbles here. So you can imagine that if these sort of little particles or like the medicine in our bubbles are right along the clot, we can improve the delivery of the medication, which is going to make it more effective. And there are a couple of reasons why we want to do that based off of the structure of the clots to combine the two treatments. And so we've been, over the past few years, building this bubble ultrasound clot breaking up technology. You can see it over here. This system right now is earlier stage than what you heard the other things, especially because this is a very not invasive, but it's a destructive type of procedure. There's a number of milestones that we need to hit before we can go into patients. So right now, we're not testing this in patients. We're testing this in clots that we form in pigs. Why pigs, they are the most similar to humans in terms of the location and the size of their veins, and then also how they form clots. It turns out that humans we're kind of special in terms of our clot formation process, and pigs are the most similar. And so what we're going to do is we're going to treat these clots. We're going to use a type of X-ray imaging then to see how well we did. So this sort of dashed red line that you're looking at over here, that's the location of the clot. If we've done a good job, that area is going to be really black. And so we explored a couple of different treatments, either just the medicine alone. You can think of this as what doctors are doing now, just the bubbles alone, and then the combination of the bubbles and the medicine. And so based off our statistical analysis, what we found is that for treatments that included the bubbles, they did better than the medicine alone. So right now, at this point, we're improving upon the current standard of care for these clots. And then when you compared all of them together, the winner was our sort of combination treatment. And so what it can say is that what we're doing with this technology is that it is able to break up these clots. It seems like it's doing a better job than just the medicine. What's equally as important as we start to think about going into patients is what we're not doing. We're not damaging the vessel. So despite saying earlier bubbles can damage stainless steel, it turns out that vessels have very special properties that prevent the bubbles from breaking them down. The other thing is that we are not breaking off a part of that clot and having it embolize to the lungs or go to obstruct blood flow to the lungs. So these are good initial milestones. I would say right now, as we sort of transition into patients, that's going to be probably about a 5 to 7 year time period. This is different than just a medication that's on the market or that sort of thing. So there's a number of different hurdles that we're working towards right now. So based off our current resources and our progress, that's where we're sort of thinking. What I want you to take away from this portion of the talk is that these bubbles are doing a good job of providing a treatment for a disease that doesn't have good treatment options, or there are other types of diseases that we might target. And you don't have to look very far into childhood cancers to find those. So we're interested in a particular tumor called neuroblastoma. So despite it's called neuro, it actually forms right by the kidney initially, and about half of the kids that are upon diagnosis have metastases. So they have tumors sort of throughout their body. And so doctors basically throw everything in the kitchen sink at this. These kids have surgery, chemotherapy, radiation therapy, immunotherapy, stem cell transplant, and basically half of them don't respond. So it's kind of like a 1 in 4 chance that a kid's gonna die from this disease. So you'll notice that a lot of these therapies are chemical based. There's disease resistant to those sorts of things. Our bubbles are, it's not a chemical, it's a physical interaction. We're punching and pulling on these cells. And so the question is, can our bubbles do something to address this? And so, again, we're doing this preclinically. We're not testing this in patients. We're testing this in tumors that we form in mice. And so what we're going to do is we're going to form 2 tumors. We're going to treat one tumor with the bubbles, and then we're going to monitor the tumors over time. And so the idea here is that there are some practical reasons why we would never be able to target all the tumors in these patients. And so the idea is, let's treat one and see what happens to the entire disease over time. And so what we found is that for animals where we did nothing, we applied no treatment, this is our control group, over time the tumors grew. They didn't grow this large, this is just comically large, but this is cancer being cancer, right? It's growing over time. In cases where we treated the treated tumor got a little smaller after the application of the bubbles, and then it stayed about the same size over time. It didn't grow. What's equally as interesting is that the tumor we didn't treat did the same thing. So there's something about this that is, by treating just a subset of the disease, the entire disease is saying, oh, I need to take a breath and not grow. And so the question is, what's going on? And I can tell you, we have no idea what's going on. What I can say is we're continuing to look into this. What's sort of interesting is that these 2 images here, the green here are cancer-killing cells. So these are cytotoxic T cells for those of you who are interested, CD8. In cases cases where there's no treatment, so these animals that receive no treatment at all, we basically see nothing, whereas for both treated and untreated tumors in animals that receive bubbles, we see this proliferate. So there's something about these bubbles that is not dissimilar from this image I showed earlier of my son. So in this case, bubbles are calling all the kids together to play. Here, the bubbles are telling the body, we need to get to work and try to kill off these cancers. So what is the timeline to get into patients for this? I have no idea. So we're still very early on in this project. I will say a lot of these kids are enrolled in any number of clinical trials in terms of a last-ditch effort to try to address them. So we may actually get into patients earlier for this than when we do for the clot disease. So I talked about 2 particular applications of this technology. It's what's called a platform technology. It's really independent of any type of disease. We can modify the system any number of ways to target a number of different conditions. There's a large amount of research going into these particular applications. And in fact, right now for a number of hospitals, even in the Chicago area, you can have liver tumors treated with this bubble technology. Other types of heart and clot disease, musculoskeletal brain diseases, and then veterinary medicines as well. I will say the 2 particular applications I chose is because, as sort of a physicist engineer, my strong feeling is that, not to say that these diseases don't need improvement in terms of treatment, but my feeling is that the diseases where patients are not responding to anything is where we're going to provide the most benefit. And so that's why I chose the 2 applications that I did. So with that, I'll say thank you, and I'm happy to take any questions.